Hello everyone. I am myself Dr. 𝗓𝐧𝐫𝐞. I am the general medicine educator. So in this session, I'll be discussing this very important topic in the cardiology. So that is the metabolic syndrome, or it is considered as the syndrome X. Right? And along with that, I'll also be discussing about the syndrome Z, and following that, I'll also be discussing about the coronary syndrome X. Right, so these are the three things which we'll be discussing in this session. So you take this metabolic syndrome or the syndrome X. Right, so if you take this metabolic syndrome, there are totally 5 parameters in this metabolic syndrome. Now out of these 5, if 3 are present out of 5, right, if 3 are present out of 5, then we consider that the patient is suffering with this metabolic syndrome or the syndrome X. Now what are these 5 parameters and what is the importance of the metabolic syndrome? Let me tell you. First, let me just discuss the parameters, and then followed by that I'll be discussing the importance of this metabolic syndrome. Why is that we need to calculate this metabolic syndrome? I'll discuss. So in the metabolic syndrome, the 5 components or the parameters are: number 1, the centripetal obesity. Right, and centripetal obesity is nothing but, like, we are measuring the abdominal circumference. Right, and the second component of the metabolic syndrome is the glucose tolerance. There will be impaired glucose tolerance or the insulin, and that is because of the insulin resistance. So this we call it as right, so impaired glucose tolerance, right? And what will be that impaired glucose tolerance? I'll discuss that. And third parameter is the hypertension, and fourth component is dyslipidemia, right? And lastly, the fifth component in the dyslipidemia itself, we have 2 parameters. One is the triglycerides and the other one is the HDL. The fifth component will be the HDL. So these 5 abnormalities will be the part of the metabolic syndrome, which is also called syndrome X. Now out of these 5 abnormality, if 3 are there, we consider that the patient is suffering with the metabolic syndrome. Now the centripetal obesity or the abdominal circumference, if you take the parameters or if you take the values, like abdominal circumference of the individual, if it is in males, if it is more than 1 or 2 centimeters, whereas in females, if it is more than 80 centimeters, right? So this is one component, but this data is for the individuals of the Western origin, right? This is for the Western population. But whereas for the Indian scenario, what is the cutoff to consider it as the centripetal obesity is, right? So in the Indian scenario, right, or the Indian perspective, okay, more than 90 centimeters in males, right, and more than 80 centimeters in females, then it is considered as the centripetal obesity, right, which is nothing but your measurement of the abdominal circumference. So this is one abnormality in the syndrome X. And you see this image, This is the image of the sumo fighters. Right? In the sumo fighters, this abdominal obesity that we are seeing, it is more of the subcutaneous fat. Right? It is not the visceral fat, it is the subcutaneous fat what we are observing there. Okay, so that is the reason why these sumo fighters, they have lesser chances of the cardiac disorders. Right, lesser chances of the cardiac disease. Okay, why? Because it is not the visceral fat which is accumulated there, it is the subcutaneous fat what the sumo fighters are having, and upon that these sumo fighters regularly they will be doing the exercise or the physical activity also, which will be burning the fat, and thereby also the incidence of the cardiac disease is lesser in them. Okay, whereas this centripetal obesity, which is increasing the risk for the coronary artery disease, the centripetal obesity which is increasing the cardiac risk is, this will be the visceral fat. Right, this will be the visceral fat. All right, next, coming to the next important parameter, that is impaired glucose tolerance. So, if you take this impaired glucose tolerance, the point you need to know, first of all, the normal value you should know first. Let me tell you the normal value, and then when do we call impaired glucose tolerance, I'll discuss. If you take the normal fasting blood sugars, it will be less than 100 milligrams per deciliter. All right, and normal ppbs, it should be less than 140 milligrams per deciliter. Okay, so this is the normal value. All right, so ppbs in the sense 2 hours, after 2 hours of taking the food, or after 1.5 hours after taking the food. Now the point that you need to understand, when do you call impaired glucose tolerance? Fasting blood glucose, if it is in between 100 to 125 milligrams per deciliter, and the postprandial blood glucose, if it is in between 140 to 199, right, 140 to 199 milligrams per deciliter, then that we consider it as the impaired glucose tolerance. Right, that we consider as the impaired glucose tolerance. Now, what exactly is the reason for the impaired glucose tolerance in these individuals is, that is because of the centripetal obesity. Okay, so this centripetal obesity, this will contribute to the insulin resistance. Right, so this will contribute to the insulin resistance, and because of this insulin resistance, there will be impaired glucose tolerance. There will be impaired glucose tolerance. Right, so either the values FBS 100 to 125, or ppbs 140 to 199, or if the patient is on oral hypoglycemic drugs. So this will be the second parameter of the metabolic syndrome. All right, and next important thing is the hypertension. Now, what should be, or when will you consider that the individual is having hypertension? And included in this metabolic syndrome is, if the systolic blood pressure is more than 130 and the diastolic blood pressure is more than 85 millimeters of mercury, then this is also the part of the metabolic syndrome. So this will be considered as abnormal blood pressure. Actually, this is according to the recent guidelines. The American Heart Association, previously we used to consider 140 as the cutoff, the systolic blood pressure, 90 as a cutoff for diastolic blood pressure. The American Heart Association has given the cutoff values of systolic as 130, diastolic as 85. Then next is the dyslipidemia. Now, what are the various forms of dyslipidemia that we have is the hypertriglyceridemia, hypercholesterolemia, increase in HDL, increase in VLDL. I'm sorry, the third one. Okay, I'll just repeat this again. What are the various forms of the dyslipidemias? The various forms of dyslipidemias are increase in triglycerides, increase in cholesterol, increase in LDL, increase in VLDL, and decrease in the HDL. So out of which the increase in triglycerides are taken as one of the component of the metabolic syndrome. And how much this should be? This should be more than 150 milligrams percentage, right? And HDL is considered as the good cholesterol. Why HDL is considered as good cholesterol? Because HDL is the one which will cause reverse cholesterol transport. So what the HDL does is it will take the lipids from the periphery and it will throw them into the liver where the metabolism of the lipids occur. And that is the reason why the HDL is considered as good cholesterol. And if the levels of the HDL, if it is decreased, that is also the part of the metabolic syndrome. So out of these 5 abnormalities, if 3 abnormalities are present, then the individual is said to be having the metabolic syndrome or the syndrome X. Now, what is the importance of a patient having the syndrome X? Now, those individuals with syndrome X, they are at increased risk of coronary artery disease, they are at increased risk of cerebrovascular accidents, they are at increased risk of the peripheral arterial disease. So more severe is your metabolic syndrome, more chances of development of this coronary artery disease or the cerebrovascular accidents or the peripheral arterial disease. All right. Then after having discussed about the syndrome X, which is nothing but the metabolic syndrome, the another syndrome that we have is the syndrome Z. Right, the syndrome Z. Now, what does this syndrome Z contains? The syndrome Z, it has 2 components. What are the 2 components of the syndrome Z is? Number 1, right? Number 1, the obstructive sleep apnea, that is part of your syndrome Z. Along with that, the presence of the syndrome X. Okay, so these 2 together constitute what is called as the syndrome Z. Now, in case of the obstructive sleep apnea, I've discussed this topic of the obstructive sleep apnea in detail in the pulmonology section, right? So, in case of the obstructive sleep apnea, the individual will have the apneic episodes, right? Or the individual will be having hypopnea, right? Apneic episodes or the hypopnea. And this apneic episodes, that means complete cessation of respiration, will be there for how long? It should be there for more than 10 seconds. And how many apneic episodes should be there? More than 5 episodes per hour, right? More than 5 episodes per hour. That is what is considered as the diagnosis of the obstructive sleep apnea. All right. And along with these features of the obstructive sleep apnea, if there is also syndrome X, then that is considered to be the syndrome Z. So syndrome X and syndrome Z. What is the difference between these two? In syndrome Z, you have the addition of the obstructive sleep apnea as well. All right. Then we have what is called as the coronary syndrome X. Now, what do you understand by this coronary syndrome X is, these patients, they also present with the exertional angina. And the problem here is not in the epicardial coronary arteries. Your left anterior descending artery, left circumflex artery, and as well as the right coronary artery, they're absolutely fine, right? The epicardial coronary arteries, they're normal. So here, the LAD, the LCX, and as well as right coronary artery, they're absolutely normal. Then what is the problem in these patients with the coronary syndrome X? The another name for this coronary syndrome X, it is also called microvascular angina. So the word or the terminology microvascular angina, right? This particular terminology, that is microvascular angina, will give you the exact picture of what is the problem in patients with the coronary syndrome X. So what is the problem is, right, let me show you this image. So in the heart, you have the epicardium and then you have the endocardium. Now connecting this, the epicardium, so over the epicardium, you have the epicardial coronary vessels, that is LAD, LCX and the RCA. Now these epicardial coronary vessels, they are connected to the endocardium. Okay, they are connected to endocardium. How are they connected? They are connected through the perforators. Right, they are connected to through the perforators. Okay, so now in patients with the coronary syndrome X, what happens is the perforators which are connecting the epicardium to the endocardium, they get narrowed. So there will be narrowing of the perforators. Okay, so once there is narrowing of the perforators, what will happen to the supply of blood to the endocardium? That will be reduced, and that will result in the coronary ischemia. That will result in the coronary ischemia in these patients. So the problem here is in the perforators, that is narrowing of the perforators. So once there is narrowing of the perforators, like what will happen to the blood supply to the endocardium? Blood supply to the endocardium right, blood supply to the endocardium will be decreased. Blood supply to the endocardium will be decreased, and that will give rise to the recurrent episodic chest pain on exertion. So because the endocardium has decreased blood supply causing ischemia, on exertion, these patients will have right, on exertion, these patients will have the recurrent episodes of the chest pain. And the chest pain can also increase with emotion, right? Emotional stress can increase the pain. Why? Because with emotion or anxiety, the cardiac activity increases. Once the cardiac activity increases, the myocardial oxygen demand is more. But here there is narrowing of the perforators. So what will happen to the blood supply to the endocardium? That gets reduced. So demand will be more, supply will be less, and that will result in the pain even with emotion or anxiety. Now, how will you diagnose these patients with the cardiac syndrome X? Is that when you do a coronary angiogram will be absolutely normal, because in coronary angiogram, what is that you will be observing is, you will be observing the lumen of the epicardial coronary arteries, LAD, LCX and RCA. That is absolutely normal, right? So your coronary angiogram will not be able to detect the narrowing of the perforators. But how can you tell that the individual is suffering with the microvascular angina? That is by doing a treadmill test. Okay, so when you do a TMT will show you that there is ST segment depression of more than or equal to 1 millimeter for more than or equal to 80 milliseconds. And in which leads you observe this? You observe this in two contiguous limb leads. Right, in two contiguous limb leads. Okay, so it is a TMT, and those individuals who are not able to do the treadmill test, in them you need to do a dobutamine stress echo. So in the dobutamine stress echo, you will be able to look for the presence of new regional wall motion abnormality, right? So in whichever area the perforators are narrowing, and in whichever area there is ischemia, so in that particular area you will notice that there is new regional wall motion abnormality. Okay, so coronary angiogram, the coronaries will be absolutely normal, but it is the perforator narrowing that cannot be detected by your coronary angiogram. Then how do you treat these patients? Okay, you need to give the antiplatelet agent, that is aspirin, or you need to give a coronary vasodilator, that is nitrates. And the one which is being preferred is the isosorbide. It is not just R, it is plus. So along with aspirin, you need to give isosorbide mononitrate. Right, isosorbide mononitrate. So this will be the treatment for the cardiac syndrome X. So this finishes the topic of the metabolic syndrome or syndrome Z, and then cardiac syndrome X. Let me quickly recap. So the metabolic syndrome or the syndrome X, there are totally 5 parameters. The first one is the centripetal obesity or the abdominal increase in the abdominal circumference. In the Western population, males more than 102, and in females more than 80 centimeter. And in Indian scenario, males more than 90 centimeters abdominal circumference, females more than 80 centimeter circumference. That is one parameter. And second important parameter is impaired glucose tolerance, where FBS is around 100 to 125 and PPBS is 140 to 199, right? Blood pressure more than 130 by 85 millimeters of mercury, triglycerides more than 150 milligrams per deciliter, and HDL being reduced. Okay, it is less than 35. Out of these 5, if 3 are present, then the individual is said to be suffering with metabolic syndrome, and they require the aggressive intervention to prevent the development of coronary artery disease, cerebrovascular accidents, or peripheral arterial disease. Then syndrome Z is obstructive sleep apnea plus syndrome X. And how will you diagnose the obstructive sleep apnea is the individual will be having apneic episodes that will be lasting for more than 10 seconds. And how many episodes will be there? More than 5 episodes will be there. Okay. Then you take the coronary syndrome X or microvascular angina. In that, you have narrowing of the perforators that will lead to the coronary ischemia, right? And the presentation in these individuals is they will have recurrent episodes of chest pain on exertion or emotion, and treadmill test will show you that there is ST segment depression of more than or equal to 1 mm for more than or equal to 80 milliseconds in 2 contiguous limb leads. And coronary angiogram will be normal in these patients with the microvascular angina, and the treatment that you need to give is aspirin. Along with that, nitrate should be given. So this completes the discussion of your metabolic syndrome or syndrome Z or the coronary syndrome X. Thank you very much.